So, personally, how are you dealing with the pandemic?
I'm better. It was certainly a rough start for I know everybody, but as an assembly member, it was certainly a tense moment, probably a good 2 weeks straight of how do we get comfortable? How can I help my community? How can I help the hospitals? And how can I just communicate? What are the immediate changes that were happening literally by the hour at sometimes. So it was stressful, making sure that I'm catching everything, hearing everything, and able to get it out as soon as possible, just to keep the public and my constituents at ease and in an understanding of what it is that we're going through.
During this time, what does a day for you look like?
Well, I've tried to keep a schedule of sorts, making sure that I don't sleep in too late. I usually naturally wake up at like 6:30, and like I used to do before, check the news and hear of, I guess, what's new this morning. But as soon as I do get up, have my coffee, I get right on my laptop, check my emails, check the news, check the Twitters of the governor, the mayor. Um, any questions that I have, contacting daily with their staffs, checking in with my staff. We're working remotely as all offices are. So, we try to keep tabs. We're using that app Slack. Never heard of it, but my chief of staff put it together. But it's an app that all of us can communicate on, and we're able to work from home, check our emails, the calls are coming to our cell phones, and then just really discussing how we can address every concern that is coming our way. Because we still have constituents calling and emailing us, and we have a general email out there, and we want to be that comfort and resource to our community in this time that we don't really know where we can go because we literally can't go anywhere.
So, have you been able to go out into the community and do anything?
Yes, I have. I did quarantine myself for 2 weeks because when this pause happened, around that same weekend, I found out that my district leader was positive, and I was with him, in the same room going over paperwork. So, out of concern, and by suggestion of the Department of Health, I quarantined for 2 weeks in my house. And in that time, I did do updates, video updates. We have a daily or every 2 days a newsletter goes out with updates, and just trying to address everything that I can from my phone and my computer. But since I got released from quarantine, it was also the same week that we went back to session, because session did pause for a minute. Members were found positive. I believe 4 assembly members and 1 Republican were now positive of the COVID. So we still had to pass the budget. So that same week that I did start stepping out in the community, I've been getting a lot of not requests, but offerings. I know somebody that has masks and we want to give it to the hospitals. Can you help us connect? I have food that I want to deliver. Can you help us, get it to people in need? So we've been doing a lot of that organizing for other community members and groups. And I've been, I guess, steady every other day, making sure I can get something picked up, delivered, because it's hard to ask for help, to put other people out there, when it's something that I'm organizing. So for a little bit, it was stressful because 2 of my staffers were found positive of COVID-19. So in trying to maintain the office regime with limited ability and limited, I guess, attention, because the 2 that were ill had to take their time to rest up and get better, and thank God they did get better. They're doing much better. It was just a juggling act, like you gotta do what you can, work with what you're given, and it was a little stressful, but I'm happy to say that we got through it. Me being up in Albany, the staff did hold the fort well in keeping communication with the community, and taking care of the things that I couldn't while I was gone. But it's going. Every day is like a new mission. It's like a new, okay, what can I do today? What do I have to do today? And same way that, tasks do carry on from one day to the next as it would in the office, it's a little different in how we can complete these tasks from home and from our limited um, ability.
Have you been able to communicate with people in the district and see how they're dealing with the pandemic and social distancing and all the things that come with it?
For sure, yeah. I mean, I have community leaders that, of course, are like a branch of me to the bigger community that have been able to share with me any direct concerns, general concerns, reached out to my institution leaders, our teachers, hospital workers, hospital staff, and just kind of collecting information to get an understanding of what are the issues per area, and what are the resources nearby and available for the particular issue. So and then social media helps as well. Again, I've been trying to be active on there. I'm the one that's looking at the DMs. So anything that has been coming through, we've been addressing directly, if not from myself, from my staff. But that's really has been the portal and has been a helpful tool in any community member, reaching out with a question or concern. And, we try to get the quickest answer, because I feel like in not knowing something and waiting for an answer, it's building up anxiety in a lot of people. And, if my job can be of any ease to you, is to just get you the information you need as soon as possible.
What is the demographic? What is your district look like?
My district is a big mix. It's 45% Latino, 23% African American, 20% I guess white Caucasian, and then any few percent of other races and demographics. But my community in my district is also an elderly, I would say 50% senior elderly community. We have a number of nursing homes, and a good chunk of the hospitals in the Bronx. I have North Central Bronx and Montefiore right on my borders, Jacoby within, Einstein within, and I believe because of the hospitals, and I know then that we have a large healthcare worker community. So my district is chock full of our essential workers that are in our hospitals, that work in our MTAs, that are doing the public essential jobs, and they've been hit hard by it. If you've seen the maps with the color coding, my two zip codes, 10469 and 10461, are in the red, and I believe it's because my community is built up of a lot of essential workers, that that are out there, that are doing this work, and that are in most danger. So to see the numbers that high, I immediately want to know why, and I have ideas why, especially with our lower income community members and the areas. And I want more specific breakdowns, because the zip code is a big chunk, and knowing that zip code and how the neighborhood is, I guess, mapped out. I'm curious to know what areas might be hurting more. And in these arguments as to why Black and brown communities are affected more, it's long reasons and historical reasons. Our communities are still trying to overcome the architecture and the designing of them, with lack of healthcare access, with lack of food and nutrition access. There are parts of the Bronx, not just in my community, in my district, that are food deserts. And knowing too that our Black and brown community members are those in these frontline jobs, we can see the ties and the correlations as to why they're the ones that are dying first and most because of this disease. So it's a lot of, understanding and really trying to find the specific issues at how this can be curbed. And, for the essential workers, first thing that we can think and say is to protect them, make sure they have the protective gear, the PPE. So I've been, vocal with the governor's office in the city, make sure that they have more. I'm getting requests too from community members, we're making masks. How can we get them to essential workers? So I'm trying to be that bridge of all these available resources to where it needs to go, and hoping that it makes, a difference now and for later, hoping it saves lives.
How about the local businesses?
All of us are handling it as best they can, obviously, and it's known that businesses are hurt. The lack of income and profit is absolutely putting them in debt. It took a while for anything to really come about with small business relief, it was asked immediately, what is the city, state, and the federal government doing for us? We need grants, not just loans, but grants to help us stay afloat. And the state in particular, where I have some role of power, is we're broke. We were right in the middle of, not in the middle, but at the end of trying to pass this budget that we knew we had deficits in. And to do that while we're losing money every day, because before starting this year, we knew that we were $6 billion in the hole. Now, with the relief and response to COVID, we're almost at $15 billion. So the state is really, really tight. And, to even think and say we're going to make sure we get $100 million for small business loans, it just literally wasn't possible. So the city was able to start loan relief grants and, small business relief grants and loans. And the federal government, as we've seen, has put out a stimulus package that does have $350 billion for small businesses. But I'm hearing now that that money is already running out and that some businesses aren't even qualified to receive that loan because of, I don't know what, I even have to do my research. But I do know that the assembly members and senators are working with Congress members to try to push another stimulus package that will directly help small businesses of Black and brown, entrepreneurs and owners. And I'm just grateful for the small businesses in my district because, even though they're hurting, I see them constantly, showing up and delivering pizzas from Emilio's to a Jacobi Einstein or Jacobi Hospital, or what's another one over here? Patricia's gave two to Montefiore Einstein. So our small businesses are stepping up and helping in the best way that they can, which is providing their goods. But at the same time, the ask is there every day, every, hour. If you can support a small business by patronizing and, buying something, please do. And, that's what I'm trying to do. This is from Healthy Fresh on Morris Park. They delivered, but it's scary and, definitely nerve-wracking to see or to think of what will be with our small businesses, our mom and pop shops that have been here for generations and now don't know if they'll be able to start again once this is all over. So, the stress is out there. The fear is alive, but the optimism is higher. And I really believe, and I've seen and I feel it myself, that, the community is encouraging each other. I still see, not in the streets, like people are social distancing, but there's still some business going. And I think that's what we need to do to at least help in the now. And, on my end, to help shape or suggest a stimulus package that our federal representatives can put out to help them in the long end. Bureaucracy is a real thing, and it's so frustrating to see, what other countries are doing. And here we are still trying to decide, well, let's negotiate this. Like, people's lives are literally at stake every minute of the day. And to waste time thinking of what could be better for whichever side of the aisle, it's I think so offensive. And we just need to get the help out now.
Yeah. Are there any significant or something or things that are impacting your district and your community that is seen more in your community rather than around the city?
I've definitely gotten this from a good number of my constituents, and I've heard from other districts as well. So, and even from a friend of mine who works in Mount Sinai Hospital. A big hurdle, and I guess, wall that we're getting to is people who have lost family members, loved ones because of COVID, and now not able to pay funeral costs. It's about $10,000 to $13,000 to bury somebody, to have, a good whatever ceremony that you want. And now with the city morgue, they excelled the time that you have to claim the body. I think it used to be like 30 days. Now it's about 14 days. So that leaves 14 days for somebody to put together $10,000 to move the body and figure out, the plot placement and everything. And it's such a burden that many of us can't even think to imagine to start saving for or to scramble to get. And it really puts, families in a tougher position than they already are. They just lost their loved ones, and now you got to put yourself in bigger debt just to bury them for something that, wasn't their fault. So I'm happy to see, I think it was yesterday or maybe the day before, that Congresswoman Ocasio-Cortez with Chuck Schumer, did a press conference pushing that this is something we need to provide to our communities right now, because it's just going to put us more in debt. And then looking at the numbers, that is Black and Latino people that are dying more, it's putting our communities in more debt. So I really think that's something that needs to be addressed. And also, probably this is the mayor's jurisdiction, but to get responders quicker to homes to take the bodies out. Because I was told that, we see the numbers going down in hospitalizations, meaning less people are coming to the hospitals. But a harsh reality is that people are not going to the hospitals anymore because they don't want to die there alone. They want to be with their families. So when it gets to that point, as we're telling people, only go to the ER in the hospital if you're in severe, symptoms, you really can't breathe, so you can go get a ventilator. But there are people that are like, okay, I'm in a really bad position, but again, I don't want to die in a hospital alone, so I'd rather die in my house. So people are dying at home. And when, the families call the city to help get the body out, it could take up to 3 days sometimes. So that is, I think, something we need to work on in helping to, handle that situation, so it doesn't harm the rest of the family if the body is there, and if it did die of COVID, because they don't know until they test it. Yeah, that I think is one problem that we need to address now, and I don't think it's been spoken of enough during this the last 30 days, but it's becoming a real reality that families are afraid of the hospitals, and there's nothing that can be done really with the body right away.
There were different types of crises that occurred, like, the Superstorm Sandy was one of them, the economic meltdown in '08, September 11th, so on and so forth. And they all had different ways of, the local and state government had different ways of reacting to those situations. So in this particular situation, it's something that we haven't seen in over 100 years. How is the assembly as the body, like, reacting to this?
I mean, the assembly is, I want to say, and just in general, a little more difficult as a body because we're so many members. There's 150 of us in total, 107 Democrats. So, to work together, especially now remotely, takes a lot of communication and, awareness to, I guess, our devices right now. So, coalitions are important to get anything done. And for the assembly, if there's a certain member or a set of members that, feel a particular way, the way to move it is to get, the majority on your side. So I love the camaraderie in general with the assembly, and I'm sure the Senate has it too. But we really keep close communication with each other, rely on each other for what we're doing in certain instances, helping each other out. Like it's happened in the Bronx, a few members like, oh my God, I got this, this person that said they can do this, but I think it'd be better for your area just because A, B, C, D. And, we share resources. So I think the assembly is just, doing its best, is supporting each other. As, I've said, some members have been found positive, and trying to support the state. And, as a body with more minds, more ideas, I think we can be definitely a resource, if not, one of the resources to coming up with new ways of how to address different things.
So in terms of emergency legislation or anything that needs to be passed immediately, or things of that nature, how does the assembly manage to get legislation passed for a crisis like this?
Well, much like we're doing right now, Zoom has become a friend of, how the state's even operating. When this first struck, beginning of March, we had a week in Albany, but I believe that's when, the quarantine kind of started, stay home, stay home. And we only got called up for one day to pass one bill that would change the rules, because I believe it's in the Constitution that, you must be in chambers to vote on bills, and in Albany and all that. And that rule was placed because years ago, members, would abuse that privilege of being able to vote in their offices and say they're voting in their office and whatever. So we had to alter the rules a little bit to allow us to, speak remotely, meet remotely like this in a Zoom. So the weeks after and during the budget, we had to conference, we had to talk to each other, and we did a big Zoom meeting, the 100, something members plus central staff. And it worked just like it would, in conference. You're sitting in the room and the speaker speaks. If you want to speak, you put your hand up, you get put on a list, and you get your questions, asked and answered. So it really worked the same way. I know we got the little feature here, raise your hand. So, that was almost an easy thing. But the voting, we have the ability to vote remotely. I'm not sure yet if that allows like voting remotely, like from in your living room, and doing it on Zoom. But for the sake of the budget and probably now moving forward, nothing's been said if we're going to get called up. And this is the last week of our spring break. So technically we would be going back next week, but, nothing's been said if we are or not. Bills are still being introduced. That's for sure. And they're gaining support. But as far as getting a vote to pass, it has to be decided between the leaders. So I know the governor has said it, session's done indefinitely, or like, we can't be effective, but that's technically not true. It's up to the Speaker of the Assembly and the Majority Leader of the Senate to decide whether we're going to bring our parties up. And if the Senate and the Assembly both come up and pass a bill, then it's just left on the governor to act on it. Like we acted, we did our part, you do yours. So it's left up to the call of the speaker. And I know he does act, especially our speaker, Carl. He listens to his members very well. So if he's feeling, that we will pass something and we can work with our senators and like at least those two houses create or have communication to bring a bill to the floor, then, something can be done. I just don't know exactly which bill would do that yet. There's a few right now that are of urgency. The cancel rent bill is one that has been floating around, and I support it. But the problem is that, and this is from constituents in my district and outside my district, they're small building owners. So canceling rent stops them from being able to pay everything else that's being demanded of them. So I have a bill that would just cancel all bills in states of emergency while we're on this, pause. All bills would be paused as well. So, discussion is still being had as far as the canceling rent. I believe the governor is holding on because he's saying that his moratorium to not do evictions and not, charge for mortgage payments is channeling through to not having rents be demanded. But in some cases, we're seeing that landlords are still asking for rent. And earlier on, there were still landlords that were, serving eviction papers. So it takes a lot of, I guess, double teaching on our end to be like, excuse me, landlord, on behalf of the constituent, you cannot do this. So stop harassing them. And then actually now a bill was introduced to me today. I can't even explain in detail. I still have to read through it. But it's a memo to talk about insurance and what that means for cultural institutions and non-for-profits, because they're going to be at greater risk after this in getting back on their feet. Like tomorrow the city budget is going to be introduced, and that budget is based on the budget that the state has been able to do, and we're expecting cuts. So like the cuts are inevitable. But this fear is that, they're going to be so bad that some organizations won't be able to come back from it. So unless there's something in particular that we can do to like maybe create a slush fund, because that's what I really think we need. Like we just need the federal government to deposit like $100 million in our state bank or whatever you want to call it, and help us, cover these costs that are going to be waiting for us after the pandemic's over.
I know I probably know how this question is going to be answered, but I'm going to ask it anyways. But like, what is the relationship between the state and the federal government right now, given the person who's in office?
Honestly, I feel like it's a relationship that is ever changing, because in general we don't like the commander in chief. Our governor has said some choice words about, his lack of leadership and vice versa. And the way I've been following it, like I remember when the governor in the state like called, we're going to need help. And then the president was like, I think you're fine. And then, we got angry. And I know, like, in all lines of government, of state, assembly and Senate and our congressional members were just, shocked at his reaction. And then I remember hearing the president speak, well, they have to be nicer to me. And then I hear the governor say something, no, he's been really helpful. He's been good. He's been nice, like kind of then doing what the president wanted. So it annoyed me for a second. Like, why are you giving in to this maniac that just wants praise and then giving you, the life-saving need that you need? But, then I think, and I got to give, props to the governor for biting his tongue and just like, for the sake of what my state's needs right now, I'm going to say, okay, thank you. You're doing a nice job. And then we started seeing some relief. So it really bothers me that it's this like, my God, this, I don't know, I guess a pissing match or something of who's tougher. And, even a little bit with the governor and the mayor with the school closing, like that was just annoying I still think now it's not like fully, I guess, set, but the mayor made a decision and the governor then was like, no, you can't do that. But this would be the decision probably, but you don't have the say for that. So like it left parents for a whole 2 days. I had parents calling me and, everybody, well, what is it going to be? Should I prepare my kids to go to school or should I not? Like, are we listening to the governor? Are we listening to the mayor? And, I said, listen to the mayor because yes, the governor is right in like, we should work in a greater function of understanding how everything fits together when we reopen or close something. But I don't think like it should have been this holdup of, what's to be with the schools. And, that kind of goes with the president and the governor's relationship too. Like, I think the president being so petty and just wanting the praise for the good things and basically forcing people to bend the knee to get what we need. And I think it's just ridiculous.
You brought up the educational aspect of it. Is there anything that you can shed light on and how? And I know that you're at the state level, but is there anything locally that, or even if there's anything happening at the state, how, is there any way to, try to ease people's minds, or it's just, we got to do what we got to do?
Yeah, I mean, there are times that I have to step in and, try to explain the reason for things. So like, the schools were working remotely and, parents are expected to help follow the lesson plan and basically be teacher while the teacher is, on the screen. And I know that that's hard for parents that work full-time jobs that they're trying to do at home while trying to teach their kid all day, while trying to take care of the home and, breakfast, lunch, and all that. Like, it's the 3 jobs that you have all in one in the worst way almost. So I feel for the parents, and I really don't know like what is the answer for them when knowing they have to keep their job going, for the sake of whatever their job does, but then they also got to make sure their kid is getting their education. So when this teaching started, I guess teachers took it upon themselves to start using Zoom. And Zoom is, one of the easier apps to use to log on to, see who's there, the raising hand, whatever. But then last week or earlier this week, the mayor and the chancellor said you cannot use Zoom anymore. You have to use, I guess, Google Classroom or something. And a lot of parents and teachers were like, this is just confusing. We just got going on this one and now you want to switch it up again. That's not fair. Why are you making it harder on us? And this. And, for a second I agreed, like, exactly. This is now just creating another hurdle that we have to accommodate to, and it's going to probably, hold up the process a little bit. But when I saw why and the dangers of Zoom and what had already happened in other states, yes, this is needed because this is protecting your kids, your privacy, your identity, and all that. We saw that somehow hackers were getting into the Zoom classrooms of, kindergarten or whatever, and kind of just watching. And, there's people out there that might want to send graphic pics or something, or maybe connect to a kid somehow and message them. There's so many different things that could happen when a stranger is in your kid's classroom. virtually or non-virtually. So after explaining that to some parents, that's when the understanding came, okay, yeah, you're right. This is a security issue. We should use this because we know that this is being protected by the city, by the school, and, by the teacher, and not risking a stranger clicking into our classroom. So, for that prime example of trying to just mediate a situation and not let them, not let parents and teachers get too crazy about something.
Now, given that this is an unprecedented situation, I mean, I know, the frustrations of parents are that of, well, the Department of Education wasn't ready for this or whatever. I mean, yeah, but uh, is there any sort of I mean, you can speak in as an elected official or as somebody just observing what's happening, but is there any sort of silver lining to this virtual learning obstacle that has been occurring to during this crisis?
The silver lining, I think, in general, not so much even just for the virtual learning, but for everything else, how we help small businesses in general and our healthcare system. The silver lining is that things will change. Like we've been struggling in certain areas before this, and now seeing how the norm has left us in this position of like, what are we doing? How do we survive this? It will only better prepare us, after the fact. Maybe now finally we'll have real change and, significant conversation and action on our healthcare system and how that needs to function. Like, Medicare for all has been something that is, I don't know, maybe it's a nice idea, but it can really hurt me. But now when everybody needs healthcare in the littlest bit, it only makes it more obvious that this is what we need as the country that we are, as dense as we are, as many people and the different levels of everything. This is kind of like the stepping stone as into moving into something, different. And it kind of like a joke too, not to make light of the situation, but the memes are all over the place. I'm getting sent them all day, but in times where you say, okay, this meeting really could have been an email, you're seeing that that's true. So maybe that might lighten up the workforce. Like I feel like we've been in this way of working that, we must work all the time every day and like stress ourselves till the end to make sure that, whatever productivity that we knew we needed to do got done. And I feel like this kind of slowed us down a little bit and letting us see that we don't have to be, to our breaking point every day, and taking it slow and easy and, just communicating in different ways can still help a business function. So I think, it'll definitely change how we live moving forward after this. And I intend for the better.
Cool. So back to the rent freeze, because there's a lot of like back and forth, and there's a lot of misunderstanding. What are some of the components of the bill, and you can actually talk a little bit more in detail about your proposed legislation. What do you feel like the public should understand about what this bill is doing?
I mean, generally the bill says cancel rent, meaning no rent to be paid. And forgive me because I don't remember if that specific bill says for cases in state of emergencies that no rent should be paid. The idea and thing to remember is that, when this state of emergency is lifted, are we going to have a bigger bill, accumulated of the 5 months that we didn't pay rent now waiting for us to pay up front? Like, will there be, I guess, a payment plan after? So that's what I think needs to be understood. Yes, we can cancel it right now, but are we still going to have to owe that money later? And my bill would say cancel everything right now and then start paying as it were, like later. So, like 3 months from now, I'm not going to say the first bill you get is going to be 3 months worth. It's going to start, you know, gradually. But yeah, that's something I think that's still not completely figured out. And I have to reread the bill in detail of, what is the answer after the pandemic? Because, everybody, I believe, is going to be in debt. There's still going to be so many bills to be paid. But on this bigger level, like, will that then leave property owners not able to even keep their property anymore? Like, will that change the housing industry and, the real estate industry? So I think they're still looking into that on what would be long-term effects of doing this now into what it could be in the future.
Right. So it's not an easy fix.
It's not. And like, as much as the hashtag is great, it's very complicated and very compounded to see how it can really affect everything.
Cool. Is there anything that you've heard or seen across the state? Because I know this is very New York City, Bronx centric interview conversation. But is there anything that you've heard, outside of the 5 boroughs that that raise alarms, or you feel like it's something that's being overlooked from that your colleagues around the state are trying to express?
I mean, I know upstate, it's been expressed to me. I mean, this kind of ties back into the city issue that, people are dying in their homes and help is not coming quick enough because, the state is sharing all resources. So like, there was a conversation earlier that it was a little disheartening to hear Republican Assembly members say that, but when New York City was in like, it's hot time of we need ventilators, upstate hospitals were like, okay, we can send ventilators downstate. And some elected officials were like, well, don't take our ventilators, we might need them. And it's like, okay, you might, but you don't need them right now. So help out the rest of the state in just sharing. So even the speaker was kind of like, this is not the time to hold materials. If you don't need it, share it. And then when you need it, we'll bring it back. So I think that just adds to, the fear that the whole state is feeling like we don't have enough resources. And, we know New York City is the hot spot of this, and protective gear is number one. But, I'm sure that goes for all over the state in any public place. Today the governor said that every person riding public transit should wear a face mask, cover your face somehow. So right away, I put it out there, and somebody that I know up in Westchester County was like, well, what if we can't find face masks? We don't have the blue surgical ones. Are we going to get ticketed? Are we going to, be written up or something? And again, further remediation, like, okay, you don't have a mask, but you can make your own. Bandanas work, we just have to cover. You have to think of what is the logic between covering your face, not breathing in, the air, all that. So yeah, I just think it's a general fear and anxiety. That's one other thing that we're going to have to really address now, later, and far after this pandemic is the mental state, the mental health state of the state. The anxiety is going to go on. People are still going to be, nervous, on edge, scared for another wave of this, or even just, scared of what their life will be and their stability, going back to the debt that everybody seems to be falling in. So it's going to be a work in progress for sure. And who knows how long it'll last, but, the mental health effects are affecting us now, and will certainly be something, to look at and pay attention to and help in the near future.
What are your thoughts on, the dissemination of misinformation during a time like this?
It's not helpful. The dissemination, especially of wrong information, can do a lot of harm. And certainly, just riling up a community, a population, however many people, could be one or more. But, the second that shocking news, whether it's true or not, is shared, it moves fast. So when the wrong news is going around, it's almost double effort to correct it. So that's why I'm constantly trying to, catch the right news and put it out there first. So in case somebody does hear something, they can check on my page. Oh no, this was wrong because look, she put this, and that's one of the more important things, is to make sure you have the correct information quicker than sooner, to not allow rumors to go around.
We've all been affected, knowing somebody, or lost someone. Is that the case for you?
Thank God, no fatalities, but certainly close people have been affected. I think I said it earlier, 2 of my staff members had gotten it, and one of them, lives with her family and her 100-year-old grandfather, and he got it. So, as close as I am to my staff, they're like my family. Um, I joke, that sat on me heavy, that, oh my God, this could happen to somebody as close to me like this. And then the day after I found that out about my staff member, my older brother and his wife were found positive. And for that week, he had been feeling symptomatic and, calling me, asking me, what should I do? Should I call the hotline? Should I do this? I called the hotline and they told me, to just wait it out, that I don't have this symptom yet, so maybe I don't. But once he hit the symptoms that he lost his sense of smell, I'm like, you have it. Like, I feel like that's the surefire symptom to know that you definitely have it, when you lose your sense of smell and you have fever. And yeah, he went to get tested and he had it. And there was definitely like 1-2 days that he, told me how he was feeling, and honestly, like hallucinations too. Like, I think Chris Cuomo said it, but it really can affect you and, mess you up a little bit. So he was scared. And, there was at least a day or two that, like, I had tears in my eyes for a minute, just like thinking of the worst. But thank God, he took a turn for the better, and his wife too is recovering. And, he's able to now leave the house. Like, he's taking walks and everything now. Literally, he couldn't get out of bed for a couple days. So it hit him hard, but I'm grateful. And I thank God, for allowing him to get better like that. But it did hit me emotionally one day, especially the day that I saw so many colleagues and friends happen to lose parents. And it was that one day that Scott Stringer's mother passed away. Later that day, we found out Councilman Salamanca's father passed away. I think 2 days before, Senator Bailey's mother-in-law. One of my good friends, their mother passed away. One of my other good friends, his uncle passed away. One of my really good friends is telling me right now that she thinks her father won't make it. So it just freaked me out. And I had to call my father, knowing that he's still, his hard-head Cuban self. Like, no, I'll be fine. I'll be fine. Like, I put a napkin on my face. I'm okay. And I'm like, can you please just stay home? Like, you don't know how serious this is. I need you to stay home. Just listen to me, listen to the news, and don't think you're stronger. Don't think that, it may not hit you, because it might. And, he absolutely understood, because my brother was sick and all that. And, he then was like, okay, I'm staying home now because you're worried. I'm like, yes, thank you. Do it for me because I'm worried. But, like that day, just emotionally, it really did kind of shake me a little bit, because then you're hearing stories that, somebody felt it and they felt some symptoms. They called, no, you're fine. Okay, 2 days later, they started feeling a little worse. 2 days later, they died in their bed. So like, those stories freak me out, at how quick this can really, take over someone's body, and how even when you think you're fine and the doctor and everybody, thinks it's okay, it could not be. And, those fears just kind of linger as to, the extreme possibilities of this virus. And, further pushes me and to tell everybody, just stay home, wash your hands, stay home, and really don't think that it may not hit you, because it probably can.
So, in closing, is there anything that you would like to add or like to say that we haven't touched on, or or if there's anything that you just want to say just for yourself?
I mean, I really feel we can't say it enough. Thank you to our frontline workers, our doctors, our nurses, our transit workers, our essential grocery workers. Like, again, to, I guess, make this personal, within like that first 2 weeks of like, things still not said, we still didn't know, there was food access in the schools or anything. I really felt helpless for a second, because I'm like, okay, I'm not an essential worker in any of these cases. We're supposed to stay home, but I need to help. Like, I need to do something. I'm supposed to be a leader. So what can I do? And, in seeing how other things in my life, I needed to get groceries, I needed to do laundry, I needed to, make sure I had gas, and there's still people out there working while I'm getting it from, every level of government. Just stay home. To think that there's people, that just can't, it really makes you have to appreciate, I guess, your situation, and really appreciate the situation that those workers are going through. So any ending, just thank you to every person out there that is still, helping the mass public get by doing their job. And where there's conversations to make sure that there's a compensation fund, for those that are hit financially with it, in whatever case. And I think that's absolutely deserving and needed for our frontline workers that are enduring the worst of this pandemic.
Assemblywoman Fernandez, thank you for your time.
My pleasure. Thank you for everything, and asking me and letting me come back and finish off.